Hey, it's Dr. Adam Nally coming to you live on Facebook Live here. I thought I would jump on and let me just put up my info about who I am so people can see who I am. Thought I would jump on and talk a little bit about 9 life lessons that I've learned from the coronavirus or from COVID-19. I know it's been 3 or 4 weeks, and we've talked about, actually, it's been longer than that. It's been since the middle of January when we started talking about this, and I'm sure you're tired of hearing it. I am tired of hearing a lot about it as well. I know many people are. But I thought there was, I was listening to a comic a while back and came across some notes I had made in some things that he said. Tim Minchin he's from Australia, and he talks about life lessons. And I thought about how does that relate to the COVID-19. So I'm going to borrow from him and thank him for that, but to talk about how does this relate to you and I? What does it mean, and how can we move forward today with a lot of the things that are going on? There's a lot of patients I saw today that were literally afraid, they're fearful, and so hopefully it's a little bit of humor and a little bit of insight gives us some direction. First, you don't have to dream. People say, live for your dreams. And in actuality, you don't have to dream. Instead, you should have small goals that you should be passionate about. And what goals should those be? Those should be things that, if you die tomorrow, what did you want to accomplish before you die? Oftentimes, if we look at life and we're stuck in an area where we're stuck in our homes, and we look at what does life mean really today, and where are we going? What are you truly passionate about? And so your ability to dream big is not necessarily what was the focus is. It's what you really truly want to accomplish in your life today, tomorrow, and in the next year. And then the small things that relate to moving forward with that. So as we are having time to be together as families or together as individuals, or we're quarantined, think about what tomorrow can bring and what it is you're truly passionate about. Second, people say, well, I just want to be happy. And I don't think you really want to be happy. Happiness is a lot like an orgasm. The more you think about it, the more it goes away. And so joy comes and really truly from serving others, not from being happy yourself. So that's number 2, and I appreciated that one. Number 3, a lot of this is luck. You and I have no idea what's going to be happening. I had no idea that I would be spending most of my day with a mask on today, and doing part of my visits through televideo because we don't want to share disease. We don't want to have those things happen to us. So that's important to look at. So a lot of life is luck. So don't worry about what tomorrow brings. Live today, be there today, and hopefully you'll do well. Number 4, exercise. Many of you are going to live to 100 years old, and you're going to need the exercise. And this long life you live, if you're not healthy, you're going to be depressed. So make sure you're doing something physical. Now, I noticed there's a lot of people out exercising, especially in Arizona. We have a lot of trails, and I'm a little worried that everyone's gone to the trails and they're not at work. And so there's like 400 people on a trail instead of being isolated. So do some exercise that isolates you, not that puts you together in large groups. Walking up and down the beach at Huntington Beach is not a good form of exercise when you're exposed to 500,000 other people. So be aware of that. Be hard on your opinions. That's number 5. Be hard on your opinions. There are a lot of opinions out there about what this virus is, what it does, what's going to happen to it. There are tons of opinions out there. I heard a great analogy from Peter Attia earlier today that each of our, we've looked at all these different cities, all these different countries, and what's going to happen here, is it going to be like ours? Amazingly, the analogy is that each city is like a car going towards a cliff. And I appreciated his analogy because it makes sense. Each car is slightly different. Each car has a better braking system or worse braking system. Each car has more or less passengers in it. Each car may be older or newer. And so that ability of that car with those passengers inside, some have a better ability to stop, some don't. And it depends on the type of road. Some may be on ice, some may be on dirt roads. And so all of us see this cliff. All of us are beginning to push the brake. The challenge is that brake going to, how soon do we have to push the brake, and how is that going to affect our car? Well, our city, Phoenix, may be different from New York, that may be different from Milan, which may be different from Wuhan, China. And it all relates to the type of car, the type of road, the type of tires, all of those things. And so a great analogy is that your city may be slightly different than my city. And we know that there are some cities like New York and Washington and potentially California that they hit the brake a little slower. They've got a bigger car, a whole lot more weight behind it, and they're on a dirt road and they may slide more. So the big challenge is you need to look at your city and your individual situation differently. And there are so many opinions. Opinions are like rectums. Everyone has one. And your opinion should be looked at frequently and constantly and thoroughly examined, but your rectum should not. Now, some of you may disagree with that, but the challenge with society's arguments that persist is that many times we don't recognize the nuance between do we need to look at it constantly and thoroughly versus is it really an opinion? And so I appreciate that one. Number 6, be a teacher. One of the things that I have found has been helpful for my patients is just teaching them. Get educated and be a teacher. You're now with family. I'm assuming if you have a family, you have children, this is an opportunity to educate them and give them some life skills, give them some ability to handle stress, talk with them about what's happening and help them to understand what's going on. And so that's actually really important. Don't be afraid to share. Don't be afraid to help the next generation. My father and my grandfather told me about the great challenges that they had through World War II and Vietnam and the Korean War and these kind of things. And so we learn from that. So this is an opportunity for us to teach the next generation about handling stress and handling big, scary life events. So that's important. Number 7, define yourself by what you love, not by what you don't love. Many people say, well, I don't like that, I don't like that, I don't like that. And those people are annoying to be around. I don't know if you've been around them, but what do you love? Define yourself by what you love. I love bacon, and bacon is always the answer, unless there's a ribeye or a brisket. And so, then I'll have all 3. But define yourself by what you love. That's actually important. We have a tendency to define ourselves in opposition to stuff. And that's a challenge. That's what creates this selfish society. Define yourself by what you love. That's important. Number 8, respect people with less power than you. There are many people around you that are not as well off as you, that have less authority or influence than you. You got to respect them. You got to help them and lift them. And so this is a time to look at those around and say, who around me can I lift and help? And what can I do in my position, either as an employer, as a parent, as a father, as a neighbor, as a mother, whatever it may be. Look around and see what you can do. Number 9, don't rush and don't panic. Like I said, the car is moving, but the car has not come to a stop yet, and you haven't hit the cliff yet. So you have time to not rush, to look around, take a big deep breath. Don't panic. As when I was in training in residency, I remember the very first time a person coded or actually died on the table, and I was in the ER, and I was the doctor there. And I remember that very first time, I looked around and I said, "Where's the doctor?" Looking for my attending doc. And the nurse looks at me and goes, "You are the doctor." And it suddenly comes to you that you realize, hey, so what do you do next in these major life events? And the first thing I remember was a great attending told me one day, check your own pulse first before you check the patient's pulse. What that means is take 10 seconds and check your pulse so that you can slow down, you don't rush, you don't panic, and then you can start letting your brain work through those algorithms and those things that you are supposed to do. One of the greatest things I've ever learned whenever I have a stressful event or I was at the office or anywhere is I check my own pulse first. Most of us need to be checking our own pulse first before we make a response, before we respond, because we're all going to soon be dead anyway. So I'll end it with that. Anyway, thank you guys for joining on. Let me just look and see who's here, and I'll answer a couple questions. If there's any questions out there about this, I've been writing about the coronavirus. So if you haven't gone to my webpage at docmuscles.com/coronavirus, check out that webpage that's dedicated solely to coronavirus and some of the things that are out there. Hello, Berkeley and Mark and Kelly, Patty. There's a whole slew of you that are here. Let me see. Jeannie, I love all those too. All right, let's see here. Hey, Vicky and Joe. Any questions out there? Any changes or life events? I guess I should probably put up here 10 life events. We actually, I should have put this up earlier. We talked about the 9 life lessons from COVID-19. I'll just summarize them again for those of you who are just joining on. You don't have to dream. You just need to have passionate dedication to short-term goals. Look at tomorrow. Don't seek for happiness. Happiness is like an orgasm. If you think too much about it, it'll go away. Listen to what we talked about with that. It's all luck anyway. You have no idea what tomorrow is going to bring. So think about tomorrow. Exercise. Most of you are going to live a long time, to about 100 years old, possibly, and you're going to need that exercise. So start now. Be hard on your opinions. Opinions are like rectums. Everyone has one, but they should not be checked. Your opinions should be checked thoroughly and regularly, but your rectum should not. Be a teacher. Define yourself by what you love. Respect people with less power than you. Don't rush, don't panic, and check your own pulse. Any questions? Michelle said, I almost got to see a live video. Michelle, this is a live video unless it shut off for some reason. But it is a live video. Let's see here. Is this list written down? No, but you can write it down. I've written it down myself, but you can actually look at it. Hey, Deb, how are you? Ask me some questions. Tammy says, I'm recovering now from COVID. Can I be reinfected if I volunteer? Tammy, did you actually have COVID? Are you actually had it? You're positive for it? As far as I understand, if you have COVID, it dissipates and is gone within 2 weeks. If you heal, I mean, it's within a 2-week window of time, 14 days, once you've cleared it, it's out of your system. Can you be reinfected if you volunteer? We don't know the answer to that. We know that the test becomes negative, but do you form antibodies and how long those antibodies last? We don't know the answer to that. I wish I knew the answer. That would be great. What supplements or vitamins help with immune health? There's some things that I've been doing, some things that I've been researching. Number one, Colleen, you've got to take a good multivitamin if you're not taking one now. I made my own. That's what the Keto Essentials vitamin is. That's why I use it. I designed one that I thought was important. It has zinc. It has ECGC. It has a number of the pieces that help with immune modulation in it. Number two, we know that melatonin has actually been shown to decrease the NLRP3 inflammasome. So a low dose of melatonin between 1 and 5 milligrams nightly, it actually helps enhance the immune system and decrease inflammation with this particular viral strain. Number three, like I think I said, get good sleep, get good rest, eat a good diet. We actually find that a ketogenic diet or a low carbohydrate diet diminishes the insulin response, and when insulin drops back to a normal level, then you actually see improvement in tumor necrosis factor alpha, interleukin 1, and interleukin 6, which are the three cytokines that seem to be most problematic in severe cases of this virus. So that's actually important to look at. So those are the things that I would be looking at. Echinacea, if you start to feel ill, echinacea works for 7 days, but nothing more than that. Elderberry was shown not to be helpful for this, so be aware of that. Are people with asthma more susceptible? If your asthma is, you can hear my wife in the background calling out to the cat. If the asthma is, if you're more susceptible to asthma, if your asthma's flared up, yes, you're a little more susceptible. I guess that's the question I was trying to answer. If your asthma's under good control, you're probably doing well. But if you have asthma, you're one that probably wants to quarantine a little more tightly and be a little more careful because you are one that could have a problem, especially if you're older than 50. Hello, Vicky. How are you? Michelle says, I thought you were finishing. Well, I figured I'd answer a few questions, Michelle. That's great. Any other questions I can see? Can Xarelto raise blood sugar or cause stomach upset? Mark, Xarelto doesn't usually raise blood sugar, but some people, it can give them a little bit of a stomach upset. In some cases, I have seen that with a few people. But I was going to say that's something you may want to check with your doc about and look at closely. Although it's not a common side effect, it can occur in a few people. Let's see. Good questions, you guys. Anyway, I try to come on around 7 o'clock. I didn't get to my computer till a little later, so it's a little later when I start, around 7:30. But anyway, all right. Can Xarelto cause incra thinking, or is it just the time release? I'm not quite sure what that means, Mark. You'll have to. I'm not quite sure what that means. How's the grocery stores in Arizona? LA is not great. They're not so hot either. There's still lots of stuff missing. Your thoughts on diverticulitis? Does the SAD cause it? I'm quite sure that the standard American diet causes diverticulitis. Now remember, there's diverticulosis, which is out pockets of the lining of the colon. And when those pockets get infected, that's diverticulitis. That's an infection. Anything that drives constipation more is going to be a driver behind the potential for diverticulosis and then diverticulitis, which is an infection of that. The challenge is that a low-fat diet, the reason we've talked about eating your 12 servings of fruits and vegetables with a low-fat diet, with a SAD diet, is that you have to have that extra fiber because a low-fat diet causes constipation. And so what you notice is that what I've seen in the last 15, 16 years is that when I switch people to a low-carbohydrate diet, their constipation goes away. Let's see. Great info and much-needed humor. Yes. Is Humira safe right now? Humira. Well, Deb, that's a question you have to ask with your doc because Humira has some immune suppression. But you have to make a decision between the immune suppression benefit and the benefit from using Humira in controlling other disease processes versus the risk of having it on board during this time frame. So that's a question individually that you have to talk with your doctor about, not something I can answer generally. Let's see here. My husband is starting to freak out over bringing in the mail. This is not an issue where it floats through the air and you can get it. This is usually, I've got two cats that are fighting in the background. That's how it is in the Nally household. Anyway, let's see here. This is a disease that's passed through direct contact, or droplets that say you cough or you sneeze, and that those droplets come from your nasal mucosa or your oral mucosa, the saliva from your mouth or nose. That's how it's passed. You cannot pick this up through the mail by walking out to the mailbox, unfortunately. So be aware of that. How close to the peak of this are we? Victor, we're not even close to the peak yet. If you look at the patterns that occurred in the various countries, I think we're just at the beginning of a 2 to 3 week rise. That's what I think we're at. I hope I'm wrong, but that's what if you look at the other countries, and again, each country, each city is kind of a different car with a different brake system, different set of tires on a different road to stop that car coming up to the cliff. That city's vehicle may be different than another city, but what we're starting to see in regards to the rise is that we're just at the beginning of a 2 to 3 week peak, unless we quarantine. That's the whole point of the quarantine. Hello from Illinois. Are you concerned with EMFs? Am I concerned with them? I have concern about them to some degree, but that's not something that I'm worried about at the moment in regards to how is that going to affect me today and right now. That's one of those short-term things that you got to look at currently. Why do ACE inhibitors increase the receptors? It's not that they increase the receptors. It's that remember that ACE inhibitors, the way they affect the cell is these receptors make the virus a little more susceptible to entry to the cell because of how they operate. The ACE inhibitor, the ACE receptor, is a very complex system, and as we understand it, there is data. There's anecdotal data from the docs in Italy and the docs in China that those people on ACE inhibitors seem to be more susceptible to the virus if in its severity, and we think it's the way the virus enters the cell. Did you get any more test kits? I did. I got some more test kits. Yes. They're still limited, but I have some test kits. Thank you for answering. You're welcome, Margie. Is urticaria an autoimmune disease? It depends on the urticaria, Rhonda. There's urticaria as a general term for hives. There can be autoimmune forms, and there can be other forms related to contact or medicines or food. I've heard you need vitamin C on keto. I only had multiple vitamins. Is this enough? Well, there should be vitamin C in a multiple vitamin, Janet. There's a bunch of people out there that talk about megadosing vitamin C, but there comes a point in your bloodstream where the dose of vitamin C just creates really expensive urine. We know that the average person needs about 1,000 to 1,500 milligrams of vitamin C per day. More than that seems to just create expensive urine. And there's argument about that. And I know a bunch of people chelate vitamin C, and I'm still, the data doesn't stand up enough to me. There's lots of anecdotal stuff about it, but the science behind it is still shaky in my perspective. My husband is getting afraid to bring in our mail. Oh, that's okay. From Amazon packages. I just say clean off your hands, clean off the package, wipe it down with an alcohol wipe or a Clorox wipe, and you're fine. We know that alcohol and Clorox wipes kill this virus in 10 seconds. So don't stress about it. I heard melatonin, 10 milligrams, and vitamin D is good for this. Melatonin we know is great. 10 milligrams may be overkill. 1 to 5 milligrams is what the science is showing us in a couple articles that I've read. Melatonin also helps slow down the aging of your skin, by the way, so it's actually helpful that way too. And vitamin C, we know that vitamin C helps to stabilize the immune system, and so if you're deficient in vitamin C, which I highly doubt most Americans are, then it's beneficial. But I would say vitamin C is not bad. About 1,000 to 1,500 milligrams is what the average person needs. How am I doing? I'm doing phenomenally well, Michelle. I'm talking about life and bacon, and it's great. How high do you think the counts will go get? Ballpark. Linda, again, I don't know. I hope they don't go high. I really do, but I hope they don't go up. But I'm worried that, like in my area, I have a huge number of patients. My average patient age is 65, and many of them have metabolic syndrome. And those are the two major risk factors for major problems. So I've been really adamant about ensuring that my patients are taking good care of themselves, because I think my patient populace is different than those docs in Central Phoenix. And so I don't know what the counts will get. So it's hard to answer that question, but I think we're at the beginning of a 2-week surge. That's what I think we're going to see. My dog heard your cat and came flying into the living room. That's awesome. All right. Will the sun and warmer temperatures kill the virus? I don't think so. One of the studies I read showed that when they were looking at how long does this virus live on systems or on surfaces, one of the surfaces was at 116 degrees, or the ambient room temperature was 116 degrees, and the virus is still live and viable. So even, we live in Arizona, the temperature goes to 120. Will that kill it? I don't necessarily think it will. But again, that's just a single study point. Do I think Italy's having such a hard time related to their carb and pasta-centric diet? I think it's interesting because each city in Italy is slightly different in regards to how they responded, and how their outbreaks have occurred. I think a big component of Italy is they are an older population. A lot of them smoke, although they have a more Mediterranean diet. So I don't think it's all pasta. I think it's more Mediterranean, which is not a horrible thing. But my concern is that people have said, oh, they're older and they're much more unhealthy. I don't know. In comparison to the metabolic syndrome and the obesity of the United States, I don't know. That I'm still on the fence with that one. I'm from Malaysia, currently under 14-day isolation. Today is day 7. A lot of stubborn people can't just stay home. I do too, Moon. That's important. Hello, Vicky. Will a probiotic help or hurt? I don't think a probiotic's going to do anything for you. Taking a probiotic doesn't do much except reintroduce good gut bacteria. And if your gut bacteria is already great, it's not doing anything for you, creating an expensive stool. People in China and Italy tend to be heavy smokers. Could this play a part? I think it plays a big part, Rhonda. We don't know fully how much, but I think it plays a big part. Do I test myself? I have not had any symptoms, and I have not been exposed to anyone at this point for coronavirus, so I have not tested myself. If I was exposed, if I have symptoms, absolutely, I'll get a test. Any thoughts for Plaquenil and COVID? I am actually really excited by the data coming out with the combination use of Plaquenil and azithromycin together. I wrote about that on my page, so check that out. Temperatures in Texas getting into the 90s, will this help kill it? Again, I answered that earlier. I don't think so, Sharon. I don't think so. How to get a Kellogg shot? How do I modify keto to help with this? Cut out all the carbs, Lisa. Literally cut them out. Do you know if anyone at home if any home thyroid tests are reliable? I don't think they are, Katie. I've not seen anything helpful. Those home thyroid tests, I've not seen, unless it's done by a standardized lab. I don't think so. Can do telemedicine, but unsure about labs. Again, home thyroid tests, I wouldn't hang my hat on it. How do I get hooked up with your telemedicine? You call my office and make an appointment. That's what you do. Mark, call my office and make an appointment. All right. Let's see here. Let's see. What is your opinion of the patient self-swab test? Oh, self-swab. I know that they talked about it today in the White House press meeting. I haven't seen them yet. I don't know the answer on that, but I'm assuming that it's a standard. It's been standardized and it's hopefully will work fairly well. Let's see here. Dallas is on shelter in place, lockdown today, and Tara might do it tomorrow. Yeah, a lot of there are those communities that are driving faster cars on dirt roads with worsening brakes. Those communities need to lock down, and I agree with that 100%. Let's see. You are very welcome, Sharon. What about the male versus female component? I have not seen any major difference in that. I think the difference that you're seeing is, I know there was one study that talked about the difference between men and women in China, where 67% of the men smoked and only 2% of the women did, and that they were seeing a higher number of men with affected lungs because of that. But again, is there a difference in the way men and women are affected? I've not seen anything that I think is reliable to comment on that. Austin may shut down tomorrow. I wouldn't be surprised. Can you order tests out of state? I don't think I can, Linda. I don't know for sure, but I don't at this point. If the state doesn't recognize my license with a lab, they may not, or other doctors' license, they may not. I can order some lab tests through LabCorp and Quest because their license is recognized across the board through the system, because it's the same company across state by state. But individual labs, if it's a state lab, they may not recognize that doctor's license. How long do I think the crisis is going to last? I think we're coming up on I think in the next 2 weeks we'll see a peak. That's what I think. Maybe 3 weeks. I hope it won't. I hope it won't. If we've quarantined well enough, it won't. But again, I don't know. I know that in Florida and California, people are out partying yesterday, and so I worry greatly about that part of it. What about different blood types more susceptible, A versus O? I've heard some anecdotal data about A versus O blood types. I don't know if that's true or not. I've not seen anything in the literature that truly points out one better than the other. I know that they'll probably do some autopsy data and look at that, but at this point, it's not something that I know. There's a lot of hearsay about that. If you test negative one day, can you just be exposed the next day and get it then? Well, of course, Sheila. If you get exposed the day after you get tested, of course you could get it. Hopefully that answers the question. You're welcome, Gail. Hopefully that helps. All right. Is the office still open? Is my office still open? Not right now, but it's open. We're open. We're still open. Yes. Any truth to when young people get it because they have advanced metabolic age? When young people get it, less than 30, it's because they have advanced metabolic age syndrome. Oh, well, what we're seeing, Vicki, is that those people that are younger do have some either metabolic syndrome or some other comorbid disease process, meaning a disease process that suppresses their ability to have an immune response and causes these cytokines to spike. I love my last video. Can you explain explain I'm pregnant and how high risk are they? So the benefit of pregnancy is that the baby and mother produce huge amounts of melatonin in pregnancy, and that's actually protective. So that's actually important. At least that's one theory as to why pregnant women seem to do better. If I somehow get it, what happens to the mother and the baby? As far as we've seen, they've done very well. I don't recommend you expose yourself to it, but as far as we've seen in the medical literature, the assumption is that because of this higher melatonin level, it actually suppresses the immune response and what's called the NLRP3 inflammasome and there's a couple other pathways that are quite complex. That's what 2 or 3 of the articles I read point out that we know thus far. But that's about as far as I can answer. Hopefully that'll help. Great questions, you guys. These are deep. You guys have been thinking heavily. Hopefully people are doing well. Anyway, I need to go pull some steaks off the grill that I put on the grill and make sure they're not burning. My family would probably appreciate it. Let's see. Can COVID, and you can see the 2 cats behind me that are fighting. Don't you love that right there? Can COVID give a stuffy nose for 1 or 2 weeks and nothing else? I doubt it. No, that's a very rare side effect. COVID doesn't usually cause nasal discharge. That's often rhinovirus, parainfluenza virus, Coxsackie B virus, echovirus. Those usually cause the stuffy nose. Should we take melatonin more than just at bed? No, the melatonin I take is just at bedtime. Usually we find that melatonin is used at bedtime. It seems to be the most effective in low doses. How about losing your taste of smell? Oh, your sense of smell and taste. That's not been one of the reported side effects, Eileen. Hopefully that answers that question. The second melatonin question. Is it predominantly male and older that getting COVID? No, Raymond, it's not. It's men and women, but predominantly those over age 50 with any comorbid medical problem like diabetes, hypertension, prediabetes, history of stroke, history of heart disease, those kind of things that are driven by insulin resistance. All right. It's allergy season, so that doesn't help. No, it's allergy season. I normally see parainfluenza virus, which causes croup in a lot of people during the season. I see flare up of asthma. I see influenza. I've already seen 8 cases of influenza in the last 2 months. So I know that it's all out there, and a lot of people are getting confused by this. You are very welcome. Just because one has on and off headaches doesn't mean corona. No, it doesn't. Let's see. It was interesting how Rand Paul was positive, no symptoms, and he only got tested because he had exposure and lung surgery. I don't know all the background behind Rand Paul and his testing, and I know some people are upset, and some people think he should have had it. I don't fully understand all that. I haven't looked into his case at this point. But anyone who gets this, I hope they do well and they heal. I will enjoy my supper. Yes, I will. Call tomorrow, Mark, if you and get on my telemedicine so we can review those labs. Let's see what you said about stuffy nose, cough, and it being allergy season. Yes. All right, guys, have a good evening. I'm going to sign off. Remember, keep the fat high, keep the carbs low, and pass the bacon. And wash your hands. And stay away from sick people.